Sandra all the time is here with the cold hard truth. She's the ears and the eyes for me and you. Every day, everyone want to hear from Sandra. And every time on the air, she's getting better. Tell your sister, tell your brother, tell your mama, call Sandra in the morning and in the evening. They always calling Sandra. And when they start fighting, they calling Sandra.
That's right, folks. Everyone is telling their mama about the cold hard truth. Welcome to another episode with more truth telling, more problem solving, and of course, more tea spilling than ever before. Sit back, students, grab your tea and turn up the volume because class is now in session. Call in at 936-2626 because your voice matters. Share your opinion on issues that matter the most to you. Good morning, K-Man. Happy Hump Day Wednesday. Hope you guys are having a fantabulous week. So far, lots going on as usual in the community. And we're going to be bringing you guys up to speed with some of the candidates this morning. So please give me a couple seconds to send out the links on the WhatsApp channel. Just a reminder, the best and easiest way, in my humble opinion, to get every news alert from the website, the show links, social media postings, to keep you well informed so that you know what's happening in your community is by simply going to the WhatsApp channel and joining that, and then, jumping on there. That'll give you all the info that you need. So, easy peasy, lemon squeezy, as we say. But if you have any issues trying to figure it out, by all means, reach out to us, and I'm more than happy to walk you through the process. In fact, we have an easy little link on our social media channel that's like a video showing you exactly how to join. A few of you have expressed that you're having difficulty joining. We know that there's some kind of little bug in there. And then how you circumvent that, my apologies, is you log in to WhatsApp on the computer, which I think most of you know that you can do that. And then it will provide you with the instructions how to join it from the computer. And once you join from the computer, then you're also good on your phone. Now, once you join, just don't forget, if you want the notifications, by default, the notifications are turned off. So you would have to go into the update section to manually see it. But if you want the notifications to show up like any other WhatsApp, then you have to actually turn that on. You press that little bell at the top of the right-hand corner of the channel, and then you are good to go, honey child. Easy peasy, just like that. All right, so get on the channel, get your daily show links. We just sent it out, and that's the easiest way to find us. YouTube, Facebook, we're on Instagram, and obviously Bobo 89.1 every morning from 7:30 until 9:30. And just a reminder about that, I know a lot of you say to me, oh, Sandy, the radio just cut off at 9:30. It's actually 9:28 to be more exact. But yes, it's only 2 hours on radio. And then we switch over to social media only. So Facebook and YouTube. And we continue the show if we're going to go into overtime, which, some days we do. Yeah. All right. So we have the TCCP group with us this morning. In case you've been living in a hole, honey child, and you don't know who these people are, perhaps it would be prudent of me to give you a little bit of information on TCCP. So this election cycle, 2025, obviously the election is starting, the election, my apologies, is actually on April the 30th. So of course, you want to make sure that you are ready for that event. If you're not an island, get yourself sorted out with your, absentee mail-in ballots and so forth. But running up to the election, we have several new parties that have formed. And one of them is the Caymanian Community Party, TCCP for short. And they have social media channels, so you can certainly go and follow them. I'll share the links here in the chat. Go and check them out. Party leader, Andre Ebanks, from West Bay, and he has a number of colleagues who are working with him, and a number of community people, because I actually know a few members now as well, who, as the party was set up, they actually joined the party. So it wasn't just, the candidates. They have a whole slate of members as well, subscribers, if you will, to the party. So if you're interested in subscribing, go ahead and check out their social media handles, and I'm sure you can reach out to them for more details on that. So they're going to now have very focused discussions. You'll see, a number of different candidates coming on that are running with this party. They are actually onboarding additional candidates, I understand, as well. So over time, you'll be introduced to those persons. Please remember that they are paying clients. And so we want to give them the respect that we would of any other paying client and have the opportunity to have their say once they are here on the program. So today the focus is around healthcare and actually, quite frankly, which is an interesting conversation, health insurance costs. And there are a number of things, I think, in relation to that a lot of us are most certainly interested in. So we have several different members coming on today. The first set will be Ms. Sabrina Turner, MP for Prospect. So good morning to Ms. Sabrina. How are you?
Good morning, Sandra. Good morning to everybody, your listening and viewing audience. I am fine, thank you. Always good to be on TMR.
So good to see you. And of course, she's the MP for Prospect, just in case you didn't know, and she is joining us this morning. And in relation to this conversation, she has a degree of, I would say, expert knowledge, just having been served a few years as the actual Minister of Health and Wellness. And this is the first time actually that they've added a wellness component to the Ministry of Health. So that was something that appeared a priority for the PAC government. So we'll be speaking with her. And we also have joining for this first segment, Mr. Osborne Bodden, often, known as Ozzy. And Ozzy is actually going to be running for the district of Boddentown West. Yes. That is my constituency. And so we are very, very interested to hear more about him. And Ozzy also is a former Minister of Health, amongst other things. So good morning, Ozzy. How are you?
You're on mute.
Yeah, you're on mute. You're somehow muted yourself. So just click a little something on that computer to find out where that audio is. And
it's a little mic next to a camera sign.
No, he's not muted there. So it's something on the computer itself, I think. So, all right. While Ozzy's getting that sorted out, let's continue with the conversation. So, Sabrina, having just served as Minister of Health and Wellness, I want to talk about, we're going to get into the details here of healthcare, generally speaking, and then health insurance costs. But you were instrumental in making a priority to add wellness to the Ministry of Health. Why was that critical for you?
At the time and taking elected office back in 2021, I felt it was critical to look at healthcare, not only to look at it, it's multifaceted, but the element of wellness meant that we were looking at it holistically. A lot of us have medical insurance and we didn't even know that there was a wellness arm to it. And we wanted to get more so from a preventative care instead of seeing people at end stage. So the wellness component incorporated persons to maintain, to being proactive, just looking at it full circle and not just when people are in an emergency and having to attend the hospital. That also opened up room for conversation, opened doors to involve even private stakeholders to join us in this effort. You can look at all the restaurants here along in the Cayman Islands. We look at all of the the yoga studios, all the gyms, all the supermarkets. Let's come together as a united front, look at wellness, tackle it head on. And that was where it was born from. We just wanted to be inclusive.
Mm-hmm. Yes. All right. So, and of course, that's important because we saw certain things happen, such as that wellness survey. That it turns out it was very, very critical, and some interesting information has come out of the results of that survey. 7 out of 10 people in the Cayman Islands, having to struggle now with obesity, and this is quite shocking, to be honest.
Yes,
I didn't think it was that high, but I guess.
That was the STEP survey that you're referring to. And
yes.
I want to publicly thank everyone who took the time out to really engage when we had our persons out to gather this local information, which is critical for decision making as policy makers for the Cayman Islands. But again, that was something that had never been done. There was a 12-year lag since the last STEP survey was done. And coming out of the back end of COVID, having to make critical decisions, having had to go through a budget cycle, I wanted to be, as the Minister of Health, in a more informed way to know what the status, what was a measuring tool of the health of our nation. And by being able to join up and have an exercise like that, we have critical data that was collected that is unique to the Cayman Islands, so that we can forecast and see trends as to where the quality of life and the status of health of our citizens is in the Cayman Islands, to be in a more informed position when we're making those decisions on prioritizing preventative care, what services we're going to need, but needs to meet the care needs of our people, but most importantly, making sure that it is adequately able, less cumbersome to access affordable healthcare for everyone. And you mentioned obesity. Of that survey, yes, it's true. The numbers came out that it was 69.9% of our population full within the age range were considered overweight or obese. So that's something all we can do. I know you're on your way, and myself have made some minor adjustments as well. And I always said, a little fun and joke in the ministry, I didn't want to be the first female Minister of Health to really get into elected office and leave bigger than I came in. Thank God, yes, so far I've actually lost weight. Because I wanted to be an example setter when you're there sitting down and you see it, the raw data at hand, that we have to take this under control. We have to invest in our health. And that's why it's important for us to be with the TCCP, to share in our vision and believing that, being able to provide basic healthcare services to everyone, be it multi-generational Caymanians or even those new Caymanians that are here, that is affordable healthcare is being able to be accessed by all who live in our shores, but more for those who are definitely in need and those who can't afford it. And that's why it's important for us to have this topic here today.
Really important discussion for sure. And as you rightfully said, there's so many of us who, we just think we come up with all sort of colloquial terms for what it is that we are. And obesity is the correct medical term for it. But, we're like, she's just fluffy or
big boned.
Big bone, yes.
And very Caymanian, that her breed, well, her mama, her grandfather, big bone.
Everybody was big.
Well, she can't help that because, her great-grandparent was high blood pressure, or that whole breed of the family knows that they have diabetes. We can actually make minor adjustments and minor changes to actually curb that. Some of us, yes, needs to be monitored by a professional, but there are minor changes that we can do in everyday life that can make a huge difference in the quality of life that we have, which is most important. We have seen statistics where persons can live a long time with diabetes, but have lost a limb or limbs. What is their quality of life? What is the far-reaching impact that it has on their family. Their loss of income could be affected. So these are critical things,
Yes.
little steps. We're seeing where we've had an increase in persons even on dialysis.
Yes.
Where is our country on a national level prepared in making sure that these services are
Mm.
adequately available so that our patients, our people, can access them and get the right care? So
Mhm.
yeah, this is something that we can all do together. And from a national standpoint, that's why it was helpful that we keep saying wellness, wellness.
Mhm.
Let's invest. Let's speak with those stakeholders
Mhm.
and do this together as one key man. Yeah.
Yeah. So I think that Ozzy is ready now to join the conversation. Good
Excellent.
morning. Morning, Ozzy.
Good morning.
Yes, morning.
Good
How are you?
morning.
Sorry about that. One setting
Yes.
was off,
Okay.
but
Yeah, that's
just
all it
want to,
takes. Trust me.
yeah, I want to say good morning to you guys as well as the listening and viewing audience.
Hmm.
Good to be here as usual, Sandy.
Thank you. Thank you so much. So, Ozzy, we were just talking about the added element of wellness to the portfolio, the Ministry of Health and Wellness during the last time. And I thought that that was so important because it certainly sent a very, very strong message about this additional component. It's not just health, and we will see that our overall wellness impacts so many different things, including the cost of insurance. Obesity is now being defined around the world as a disease. And, physicians are trying to raise the alarm about the importance of individuals as well as countries and communities taking control of their health because there is actually quite a bit that we ourselves can do to allay, either offset or delay the onset of diseases, lifestyle diseases such as diabetes, high blood pressure, and so on. But it starts with education, it starts with knowing the dietary changes that we need to make as Caymanians who love to have all of our starchy foods. We pile up a plate full of food and you struggle to find any vegetables. Normally we call one little piece of tomato and maybe a few shreds of lettuce veggies. And I always chuckle when I go to our local restaurants and I say, "Oh, can I have some veg?" And that's what I get. I'm like, "No, no, I mean like steamed veg." Okay, I'm being kind of crazy. So it is, to a large extent cultural. We have grown up learning to love and eat all of the wrong things. I often sometimes reflect when people say, "Oh, but Sandy, you have fast food people, advertising on your platform." I say, yeah, but you don't have to eat it. First of all, you have choices, and there are healthier choices even on restaurant menus.
Yes.
And but they think just because they eat at home that that's healthy for them, but yet they're piling on all the seed oils and 2 cups of rice for every single meal and all this bread kind and provisions. And it is just something that we need as a community to get under control. And so I know wellness wasn't a part of it when you were a minister, but tell us, what were some of the general concerns, Ozzy, when you were Minister of Health that you were dealing with?
Okay, Sandy. Well, first of all, before we even get to that, I want to stress the point to the audience that this country has never had a two-term, apart from back in the 90s when Mr. Eden was health minister. We have not had a two-term health minister since that. You had the rotations of the Gilberts, the Marks, yours truly, uh,
Mm-hmm.
Aldens, the Roys, and the Jane Seymour, and now Miss Turner.
Mm-hmm.
And I think that honestly, when you have a stop ministry like that,
Mm-hmm.
everybody brings their own style, and everybody has their own uh, wish list, as it were, and agenda. And until we can get a situation where we have more consistency, we'll see the benefits. Because right now, Minister Turner, former Minister Turner, had a lot of rods in the fire, a lot of good things that were coming out of that wellness, and
Mm-hmm.
she's alluded to some of that already. And unfortunately, because of what transpired, that's all cut short, sitting there now collecting dust. So we're hoping that we can get back, have control of government, and Minister Turner can continue with her work that was really, for the first time, focused so much on wellness. So having said that, we know how much we love the nice taste in what we grew up on, mama cooking food. And unfortunately, it is the statistics are staggering. I think it's like a 70%, is it, Sabrina? That's
69.6 came out in the STEP survey.
I mean, anyone who went to the last few healthcare conferences that was hosted by ministry and the HSA would know that the statistics are staggering. It's quite scary, actually. I know a lot of people leave there and go grab a salad because that doesn't last long, but at least it scared them enough that they did that. But you know, we have to get the country in a healthier position, and it's certainly it's called preventative healthcare, which I did have as you know, during my tenure, my 2-year tenure. But of course, we were not solely focused on that. But preventative healthcare is always the best way to go, and this saves lives, it saves costs, and it makes things better for everyone. So I'm looking forward to the people looking at what the TCCP has to offer, the quality of candidates, the experience. I mean, here you have two former health ministers right here on the show, and we bring a wealth of knowledge. The minister has the responsibility for policy. In my case, as HSA chairman, then it was my job to implement that policy along with the management team of the HSA. And we worked really hard in the 3.5 years that I was there. We achieved a lot at the HSA, I have to say. And I think there's a lot of good things on the horizon for healthcare, but I'll leave it there for now.
Yeah, well, thank you, Ozzy, for reminding us that you're coming hot off the heels, actually, just resigned some weeks back, of being the chairman of the Health Services Authority. So you were still very much in the trenches and involved in the healthcare, the provision of healthcare here in the Cayman Islands, but just more on the the administrative side of things as chairman of the HSA and kind of steering them, which is a government-owned hospitals, sort of steering them in a more efficient direction when it comes to them actually providing their services. So you're still there in the trenches and still very much aware of some of the issues that we are facing, and of course some of the concerns specifically to the government system, which some people have no choice but to access and rely solely on HSA for their healthcare needs. So still a very, very critical. There's been private hospitals obviously that have come on board that offer a variety of services, but HSA still plays a key role in for so many in the community. So Sabrina, let's talk a little bit, if we can, about this STEP survey. It's one of the things that, again, do we have any sort of a number? I mean, a dollar sign number on how much we are spending on healthcare because of things like obesity and the related diseases, such as high blood pressure, diabetes, people having to get limbs amputated, the fallout of our lifestyle, our lack of movement, and all these things. Do we know how much extra, if we didn't have 7 out of 10 people living on this island that were categorized as obese, how much money could we be saving? Because we're going to be talking about insurance, and the cost of insurance keeps escalating. And one of those reasons is because we're so heavily reliant and using it.
To give at this very time, to give an exact specific number just for that, I would not be able to, but we get it. It's costing us when we look at the 2 output items of the infamous NGS 55 and HEA2. Those 2 buckets are funding that the government has in an executive output that makes sure that we care for our indigents, our seafarers, our veterans, underinsured or geriatrics, and that would cover all local and overseas referrals of care that is not adequately available locally or at the HSA services. And we know that you hear me as a minister, and I'm quite sure my colleague, Mr. Ozzie, can attest to this, that's the biggest fight around a cabinet table. When you're fighting to get adequate funding for that we know is can run into the 54 million. We have cases where we would have like one particular medication, and let's say a indigent or persons who need supplementary insurance, one medication can cost up to $1 million. When you're fighting for a budget as a minister, and you have a legal responsibility to take care of our people, because that is what you do for your country and your people. And there are medications out there right now that one dose alone can be $1 million. So this is something that is far reaching. It is like I said this morning, why it's important for us to remain on topic of being able to highlight some of the nuances, how we can better the system, so that our people will no longer feel like that we have failed them as a jurisdiction. And having the necessary legislative framework in place, that persons can access and obtain adequate health care to better themselves.
Yes. Wow.
But it goes in the millions.
Yeah.
And you're sharing that same pool to also deal with our roads or schools. You're dealing with other people's daily life that they can't do it for themselves anymore. You're looking at the tourism. So this is all one pool, and we have to come together with level heads, but prioritize what's important for our people.
Wow. And I mean, this is how government works, right? Because I'm really quite glad that you mentioned that, because a lot of people don't understand how the competing interests work. They think, first of all, you have an unlimited budget and money to spend, and it's important to know that you don't. You have budgets that you have to work within. And then on top of that, you have competing interests. So what is the priority for the people of the Cayman Islands? Is healthcare going to be the number one priority? Is it going to be, education? And oftentimes you can't even say it's going to be one over the other. It's becoming a question of, let's see how we can share what's there, a little bit to healthcare, a little bit to education, and trying to move the needle forward as it relates to both of those. And so I have found that this is something that oftentimes people don't understand. It is something that they grapple with. And you have to, when you're sitting there in cabinet, I have to wonder this, how do you fight for more money for healthcare? Like, what are you saying to your colleagues, especially knowing that probably 99% of them are overweight and obese? I mean, maybe it's not I think, okay, general population, 7 out of 10. We've done this analysis before. And not to try to make light of this or, make fun of any of our elected officials, but the vast majority of them are categorized as obese and carrying way too much weight. So we can kind of look at them and go, we don't think that it's a priority for them. So how do you sit down and talk about healthcare, why it's a priority for the country, if on an individual basis, it's not even a priority for elected members? Their own health.
That is why taking a data-driven approach and being able to work with a cohesive group of individuals, having a set clear guidelines as to what we're actually going to be championing, but it's coming from an informed place. Media such as yours, platforms such as yours, and you engage not only in your canvassing, but as an incumbent candidate. I have been hearing firsthand that we have Caymanians that are leaving here who don't see themselves being able to retire here because of the cost of healthcare, being able to even sustain themselves if they have to pay a portion for their medication, that they're looking at other jurisdictions instead of enjoying those golden years at home because we have the proper legislative framework. We have that it makes it accessible to them, and they don't feel that they are begging. We needed to have the necessary processes in place, and being able to sit around the table as the minister, which that's what you do when you're in a ministerial role. You look at what the issues are at hand, what is a collective theme, your administration, by the support of your cabinet colleagues and caucus colleagues, what you want to accomplish, but to actually meet the needs of the elected persons who actually have elected you to serve them. And this is why I stand boldly to say that when it comes to healthcare or the security of our country, education, and definitely, of course, our financial services, there shouldn't really be politics in there. Because if you don't have an educated society, you don't have a healthy society, where are you going to get the energy in order to make the money to make our jurisdiction attractive? And that's where public health comes into all of it, and the safety of our borders. So when you look at all of that sort of stuff, you have to go in as a cohesive group of individuals, be able to have the mature discussion, but also be able to show the people of your country that you have the necessary national health strategy that is pretty much the constitution of how your country looks at healthcare. That shows exactly where your country's trend of thought is, that equates to the quality of life, peace of mind, and mental health is all wrapped into that, Sandra.
Yes. All right. So we're going to take some questions now. We see some people coming in with questions in the comment section. Again, folks, how this group has decided to organize themselves is they're having different candidates come on to talk on different issues. So this morning, we're talking about healthcare and the cost of, health insurance. That's going to be the two focus areas for today. We've got two former health ministers and also Mr. Ozzie having just served, my apologies, as the chairman of the HSA board as well. So between them collectively, quite a bit of knowledge base here. And now we will start to look at some of your questions. So please keep your questions as much as possible on topic. We do have Orlando. He says, pardon my manners, because he asked his question first. Good morning. And his question is directed at Sabrina. He says, are you proud of the work you did when you had health? And what did you get done? So this is a very good question. Thank you, Orlando. As people are getting ready to go to the polls, they are asking the question. If you're already in there and you've had some experience, they want to know what your experience is. If you're a newcomer, you've got to have some real world experience out in the world. It might not have been as an elected member within government. So Sabrina, in your tenure, you obviously received a lot of criticism for not being able to deliver on the mental health facility. So we'll talk about that here in a second. But outside of that, what did you accomplish? We heard you say one thing just now, but you got to break it down for people because I'm sure they might have just missed that. You said in 12 years, and that was quite a time, there was not a health wellness survey. And so you're under your ministry and your tenure, that was done. What else did you get done and accomplish?
I think it was the question was posed by Orlando. Thank you. Excellent question, Orlando. And I must say, I am very proud of the work that I was able to accomplish. And I think we've done such a great work since we got elected. And definitely as your Minister of Health and Wellness, being elected when we took office, being responsible for the Ministry of Health and Wellness, charged with the safe reopening of our country as we were in COVID at the time. And I think people tend to forget that when we took elected office, there was pretty much 2 years that the Ministry of Health and Wellness was just overwhelmed, well, not overwhelmed, but inundated with COVID regulations, that there was really nothing else we could focus in on at that time. So proud to say, yes, I am proud that I got in as a first elected politician, got the Ministry of Health and Wellness in the middle of a pandemic, and we were able to reopen our country safely. And here we are now, hindsight is 2020, be able to have this conversation. proud in it to say that when the dust settled and we were opened and back to as much of a normalcy as we could, I went ahead and I got my colleagues' support to get the Pharmacy Act that was sitting there from 1967. That act was passed on the floor of Parliament. I know it was discussed back in the early 90s, but was never enacted. We were able to, under my leadership, we were able to get that Health Pharmacy Act back up and running, passed in the floor of Parliament, and regulations are right there now, just being finalized when I left office to actually just implement it. On top of that, there was another key legislation that there was blurred lines as to how you handle persons with mental health issues that found themselves in trouble. How do you handle a mental health person? How long can they be held in custody? There were blurred lines as to who would respond, how they would respond. That piece of legislation and regulations was something that I brought over the finish line along with the support of my colleagues. Immediately after that, I began work, of course, on the providing the national health strategy. We also began on looking at national clinical standards. When you're looking at even what, under my leadership, the chairman of the HSA, which I'm sure Mr. Ozzie will go into, under their directorship, you can see the improvement of the healthcare services there, the various services that they're able to provide, the environment. You see that had a new branding, you see that they had a facelift. It is just amazing to say that I am proud. Yes, I am. And there's lots more. Once I'm returned into elected office with my colleagues, there's at least 5 key stages of legislation that I would come already with that background knowledge, that I would be able to hit the pavement running. So you would have continuation, which was alluded to earlier on, that is grossly lacking in health and wellness for decades. So proud. Yes, I am.
Yes. All right, Ozzie, let's ask you a similar question, because we know that you have not been an elected official now for a few terms. So give us an idea of when you were there, what you actually accomplished during your tenure. Uh-oh, you muted yourself again. Just unmute yourself. I think it's actually in the chat. There you go. Try that. Yeah, you're okay now.
I'm okay now?
Yes.
Oh, I don't know what happened there.
Yes.
Anyway, yeah, just 2 terms on this. 17, I came out. So you guys are hearing me, right?
Yes, we can hear you perfectly fine.
So that was a perfect segue into what the board that Ms. Turner appointed and I had the honor of leading was able to achieve. There's so much. I actually did an analysis of what this board that I had the honor to lead achieved in 3.5 years, and it's quite staggering actually. And that's not being boastful. It's really we had so much work and we tackled it, and I had an excellent board. Most of them are, well, 6 of them are still there. They have a new chair. I wish all the best to Ms. Dilbert and for the time that she will be chair. And I'm hoping that that board will continue some of the initiatives. But well, first of all, everyone can see the facelift. That's quite obvious. But what even more importantly was the level of service being offered. The type of different services. We branched out into services that the hospital never previously offered. And you know, the Smith Road Center is 80% occupied by the HSA, for those who may not know that. But we have that compound. We have therapist services down in Baytown by Kentucky. The back to Smith Road Center is where we have all our specialty services. When you go in there, I'm proud to say you feel that you're in the US in terms of the quality of presentation of the offices and the level of service that you get. I'm not saying everything is perfect at the HSA. Nothing in healthcare, nothing is. It's a dynamic business. It's changing. People's demands and expectations are great. And of course, everybody wants to be seen like that. But unfortunately, the world doesn't work quite like that, but we have done a lot to reduce waiting times. We have a patient experience services team there that you can reach out to and give them, find out from them what's going on, get support from them. They then take that up to management. While we were there, the fleet of ambulances were a disaster. We bought 6 new ambulances, and they're on the road. We opened up a temporary facility in Bodden Town, which is a lifesaver, cuts down waiting times dramatically. That's housed at the moment at the church hall of the Chapel Church of God. Thanks to Pastor Rose and his team for allowing us there. And that is moving very soon down to the new hall that was opened across from Rankin's Church, the big church hall that was open for the same Chapel Church of God. We have an arrangement with them, a rental of a space on the west side that will house the EMS team, and we will also have ambulances on hand. That is a godsend and something that we pushed, myself and Minister pushed very, very hard to get done. It's taken, unfortunately, in government, things take time, and we tried our best and we pushed and prodded as much as we could. But when you get involved with planning department and all that good stuff, things get a bit drawn out. But it's almost here full time. But we have not forgotten the BRAC and all of this. We've redone operating theaters here and in the BRAC. The BRAC hospital, the Faith Hospital, is so many nice things that were done there, and Dr. Belisam is smiling from ear to ear. We have a new X-ray set up, and there is a building proposed because they are out of space there. They do need a new building, and that's on the cards to be started in the very near future.
Okay.
And there was the whole morale. I'm proud to say that we were able to lift that, and our dental services, we've cut down waiting times there. We have a new chief dental officer who's doing a great job, and people will tell you they go and they see the difference in the smiling faces and the type of service that we offer, because that was my great push. I'm a stickler for customer service. I run a business, and I know what it is to offer good customer service. I do not have the fanciest or prettiest gas station up the road, but what you do get when you come to Launders Rubis is you get good service, and it makes you come back. And this is like the hospital. If you're not treated well and you don't get good service, you're going to look alternative. And right now, I'm proud of the course of what we achieved with the help of the minister for guidance. And I just want to, she's my colleague, but I want to make a real plug here, and this would be whether I was running with her or not, but she was an excellent minister for our board. She did not interfere. She gave guidance, advice. You must remember too that the minister is a former healthcare professional herself. I think some people tend to forget that.
Yes.
But she's a qualified nurse, and she has a good idea of what healthcare is all about. And she gave us the guidance and the latitude to do what we needed to do. We had regular meetings with her, and us and the management team were able to come and explain what was going on over the past few months. And then she was able to give us her take and what she was hearing from her office in Prospect and elsewhere on the road or wherever. Because remember, ministers, they get information from all over, and therefore when she brought that to us, we were able to act upon that. And the board was always receptive. Management team was responsible for implementing the policies that we come up with in a strategic session once a year. We sit down in a retreat, spend hours looking at the direction that we want the HSA to take. And then the management team is charged with taking the CEO in particular with ensuring that those directives from the board, which from the monthly board meetings, as we go through the various development phases, they go down the line to management, and management in turn puts it down to her team. And so there was a ton of work being done, not to mention that we are dealing with a very old hospital. The
Mhm.
hospital, when it was built in '99, was built 20-year life expectancy by Minister Eden and his team at the time. That hospital is well into 26 years now.
Mm.
And what we had to do while I was there was nothing short of mind boggling. I used to make jokes in board meetings that when they started, when the infrastructure team would get up to present, I'd go, well, you guys, I really don't know where we are this week, because before, from one week to the next, an area would be utilized for something else. Of course, A&E was one of our big issues there, right? And
Mhm.
still is, because everybody wants urgent care at A&E.
Mhm.
But we cannot, we cannot, there are some delays that will naturally occur with A&E. And anyway, we'll get into all that. But
Yes. All right.
I will let you guys have a word there.
Yes, we have some more questions coming in for sure. We've got a listener on WhatsApp who has a comment. Let me just screen grab this real quick. I like to put these up on the screen so people can see the comment and read it for themselves as well. And I also do it because I don't want people to think I'm the one making up these comments. Not at all. I don't have time for that in the mornings, that's for sure. All right. So this listener to the program had the following. Give me one quick second here to say, and thank you all. Remember, the phone lines are open as well. 936-2626 is the telephone number. And I see a number of you coming into the chat now with your questions, and we're going to try to get through as many of those as possible. The team is with us the entire morning. There will be some switching around 9 o'clock, but they are with us. All right, let's have a look at this question quickly. This one, a comment rather, says, "Morning, Sandra. Please share the following with Mrs. Turner. I never usually go to the Georgetown Hospital because of the wait times were long, service was subpar, and staff not very professional. So I would usually visit private doctors, but I must say, even though there's still room for improvement, HSA has gotten much better under Ms. Turner, and the lady knows what she's doing. I hope she gets in again." And of course, Ozzy, this would also be a testament to you and what you were doing directly as chairman of the board. So congratulations to both of you.
Thank you. That's very
yes.
kind.
Thank you very
And
much.
of course, all the HSA staff that's listening this morning, kudos to them as well. I
Kudos
know a
to
lot
them.
of times they only hear the negative. So it's
Yeah.
nice to see a positive comment coming through here today. All right. So WhatsApp number 93626. You can call us at that, as well as send your comments through. So let's just have a look at a few more comments and questions. So thank you. Let me see here now. Where were we? Orlando, thank you for that one. YouTuber, looks like YouTuber has some comments, says investing in preventative care will be very beneficial. Start from the primary school and make food and nutrient and wellness part of the curriculum from kindergarten. Great point there. YouTuber goes on to say, even the level of benefit for wellness on the SHIC plan is ludicrous. We're going to be talking about health insurance here in just a sec. The focus on the expense after the health is already out of control. Banana Orchid, good morning, says that the Poinciana facility is a win. However, there's still a huge gap because they don't allow people with court matters to stay there. What next? So let's integrate into this conversation a little bit here, mental health and wellness, because this has been our Achilles heel, I feel like, in this community for a number of years. Give us a brief, Sabrina, history of the Poinciana facility, mental health facility, when it was started. And we know that it was just delivered, although it was delivered and then we didn't get any further updates on what patients are there. We had a discussion, I think it was over a month ago now, that apparently there are some patients there, because I was questioning where are the patients. But it seems to have been very, very hush hush. And I don't know why that would have been. It's like they snuck them in from Jamaica under the cover of darkness. This is, I'm sure it's a partial win for you, although you were not able to officially cut the ribbon yourself. I know that you were actually there at the ceremony and the opening of it. Tell us your thoughts, and how do you respond to people who say, why was the former minister not able to deliver Poinciana Point?
Thank you. And again, this was very topical, and it was something that I can honestly say at this point, thank God it's now open. It didn't matter whether or not it was a ribbon cutting exercise, that I wasn't at the front. The mere fact that my stamp is there and the facility is open, and now it has actually highlighted, now that it's open, it has highlighted what I have been saying before, that that facility was not designed to be the end all be all of mental health here in the Cayman Islands. We realize now that we are grossly lacking a place to deal with offenders who may have mental issues. And we also realize that there's a definite need, and Mr. Ozzie can expand on that, my colleague, about the real acute mental health cases that they have been seeing presented at our HSA. It's almost, and I can break it down for you, it's almost like you need an ICU unit for mental health care, a general ward, and then one where you're not well enough or advanced enough in care that you still need an interim facility before Ponciana, which is just about preparing you to be reintegrated back into society. That facility was never one designed to deal with persons who are under the legal system. Now we realize that that's a gap, and there are other gaps that needs to be filled. Moving forward, how can we look at this? Again, it's going to take cohesive collective bodies of people. If we really mean what we say, that healthcare is our top priority, we'll definitely make sure that the legislations and access and regulations to make access to mental health services is easier, and that the bandwidth in medical insurance definitely is something that is revised. Then you look at what are the available services. We can almost agree that you are going to have to look at private-public partnership in our best way forward. And at the end of the day, whether that is from the infrastructure phase, because we have the foundation that is there, is it going to be a case where it's going to constantly be at the Health Services Authority, or are we going to build a standalone facility for the real acute cases that is somewhat embedded within the healthcare, the HSA as we know it right now? But in regards to that facility, that was something that I inherited. I conveyed and dispensed, communicated with updates as I got them to the public. The delays, we know there were some issues with the structure. There was some issues with getting some of the licensures passed. All of that was actually being project managed by our team in public health and the Ministry of Health. Once the funding was provided, they were responsible for delivering the project. My departure, it was delivered in practically days. So if I had knew that that was the secret recipe, maybe I would have considered a long time ago, but that was not necessary. What we want to do, in all honesty, is to put the people in the center of our focus with any decision that we make. And when it comes to, again, looking at healthcare, the access, the cost, health insurance, we have to remain people and patient centric. Remove all the bureaucracy, or as much as we can. Yes, we need accountability. Yes, we need oversighting bodies. And from the opening of Ponciana, we have seen, based on an article, that we need to honestly look at those who have committed crimes and where do we house them? That's another gap. So in all honesty, I am happy that we were able to have that ribbon cutting exercise done. The facility is open. We still have patients that would require services outside the Cayman Islands. So it has not really been able to 100% cover all of the care that we need for our Caymanians. But by in part, a lot of those who met the criteria to come home, to the best of my knowledge, they are here. And we are happy that at least we as a country, not as an administration, not as Sabrina Turner as the former Minister of Health and Wellness, but patient-centric, that they are back home. And that is a win for our country and everybody who is impacted with mental health.
All right, let's continue with the questions. Thank you for that response. Andrea says, I was at HSA emergency all day yesterday. When I entered, there was an ambulance. I thought I'd not survived my symptoms. Oh my gosh, Miss Andrea. I was so relieved with the whole time from ambulance mannered by young Caymanian trained emergency crew. All my worry dissipated after an hour with my nurse and doctor. Kudos to Honorable Sabrina and also to former Chairman Mr. Ozzie.
Let me tell you something, Sandra, and Mr. Ozzie can attest to this. We have a group of individuals in our healthcare services, and especially at HSA, that they really, really understand that when you're in your most vulnerable state and you have to access healthcare, the importance of that bedside nursing. And this is why it was easy for me, having been a former nurse, to understand and see the direction as to where we had to go. Thanks with the directorship of the HSA Board of Directors under the chair of Mr. Ozzie. He got it as well, being a former minister. But we have a phenomenal set of people at the HSA, bearing in mind, we endured a pandemic. Those people have been working constantly through and through. And as we have moved into normalcy and living with what that pandemic brought on the entire world, our healthcare champions are still with us today. And so there's a silver lining in every adversity, I know. And I'm happy that we were able to highlight them, see the career opportunities, see the gaps that needs to be filled. And now we're slowly but surely, but the fact is we are aware, addressing those gaps and making significant strides in improving access and the quality of care when you have to visit the Health Services Authority and other stakeholders as well.
All right. Well, thank you. Thank you so much for that.
And if I may, you hearing me, right?
Yes, sir.
Okay. So first of all, I want to say I'm very happy to hear that Ms. Andrea is well and got a really good service. Our EMS team is phenomenal. We have just under 40 people that make up that unit, and that is, to me, like the front desk of Cayman Airways. That's your entry when things are really bad. That is your entry to healthcare, and that is where you get your first impression. For some people, sometimes it's their last, unfortunately. But our EMS team saving lives daily. You cannot say enough about them. And when they get you safely to the hospital and you move into A&E and you get great service there as well from the team, you only hear the negative, sadly. You hear the long wait times, and you know, my child was crying and had some pain. But there's somebody maybe in that A&E room it's a life and death situation that the team is working on and trying to save. So let's have a little patience, and trust me, our waiting times in Cayman are minute compared to you go overseas and go to A&E and you will see a long waiting time, you know. So yes, everything is relative, and we're small and we should be quicker. We admit all that, and we've put a lot of things in place there. A&E has been completely redone, and the staff are on board with the changes that are needed there. We also opened an urgent care unit in the old hospital section, and that is to take away what is really not really urgent or life and death, and send those people over to urgent care. And extended hours, weekend times, all that is in place. We have to bear in mind that our health services in these islands started with a tiny Georgetown hospital. We are now in a country that has a myriad of health services being offered by many different private entities, but we are also in a country that the population has exploded. So we do not at this time, our health services, unfortunately, the Georgetown Hospital is still the center of healthcare in these islands. And we do not and cannot keep up at this point until there is a serious look at what we have to offer as a government hospital. And I dare say here that one of the things that's needed badly is a new hospital. You can take an old building and an old system and rejig it as much as you want, as I referred to earlier, but eventually you're just simply out of space. You're out of the level of service that you need, the structures that you need. Some of them are not what they should be. We've even moved the administrative folk out of the hospital over to Citrus, and we have taken that whole upper floor that was admin and put additional beds into it. That is pushing as much as we could, because the hospital, there's only certain parts of it that you could put a third floor on. And again, you could not do that third floor with services going on below. It's a hospital. So that became impractical. So we did our best, and we got 11 or 12 more rooms added on to the ward upstairs.
Let's take a caller, Ozzy.
Pardon?
Yes, we're going to take a caller. So we do have a caller. Lots of questions and calls coming in. I'm going to try to get through to as many of those as possible with our candidates, obviously giving you, their responses. So caller, thank you for your patience and good morning.
Good morning, Sandy.
Morning.
Good morning to your guests.
Yes.
This is Troy Leacock.
Morning,
I'm really
Troy.
pleased. Good morning. I'm really
Morning,
pleased
Troy.
to hear. Good morning, guys. I'm really pleased to hear the conversation, really addressing mental health. And despite the delay in the opening of the Ponciana home, thankfully we finally have that. And I think that also as a society, the fact that we recognize the importance of mental health and the treatment of mental illness, and we're becoming more open about it, I think that we still have a very important and glaring gap in the treatment that's available. And that gap is the integrated treatment of mental illness and substance abuse. Because the co-occurrence of substance abuse and mental illness is extremely high. But if you look at what we have, Ms. Turner's already highlighted some of the gaps that we have in the treatment of mental illness, from the hospital ward for acute treatment through the various stages that she talked about. But in none of those do we actually talk about how do we treat substance abuse as a part of that. So what actually happens is we have this situation where substance abuse treatment and counseling almost is, it's in another ministry from the health services, which are in the health ministry. But the co-occurrence is very high.
Absolutely.
So we actually make it very difficult for someone who's experiencing both of those illnesses to be able to be treated in any kind of integrated fashion. And in fact, in some cases, we make it impossible to be treated. So for example, someone who is at Caribbean Haven for substance abuse, their ability to be treated for their mental illness, be it bipolar or schizophrenia or whatever, in resident is virtually impossible. And I think one person made a comment about, if you have a criminal record, or I don't know, if you have a case pending, how do you get treated at Ponciana? Well, in many cases, somebody who's suffering from mental illness and needs the mental illness treatment, they are struggling with substance abuse. So maybe they're smuggling, some drugs into the mental health ward when they're there. And then what happens then is the mental health ward is not geared up to deal with substance abuse, which is almost as a crime. So it's basically mental illness is treated as an illness, but substance abuse is treated as a crime.
Good point.
We've got to bring those two together, and we have to treat them in an integrated way. And then the second point is that integrated treatment needs to go into the community. I live in West Bay. If somebody's having a manic attack, a bipolar manic attack, or they're having, let's say, I don't know, a binge on cocaine or something, the chances of them getting on a bus and getting to Georgetown Hospital is nil. We need to have our community clinics. We have to have therapy and counselors available in our community clinics, that someone could walk in off the street and be recognized that they're in an acute situation and they actually need to go to the ward right now. I cannot imagine the amount of productivity that is lost by people in our community, their inability to work and function, and the amount of money that it takes to support them. If we are able to get this treatment better, I think that not only will it be basically pay for itself by the reduction in financial assistance, but also the productivity of our people, and actually making them feel that despite the amount of support, that they can actually be a productive part of our society.
All right.
So integrated substance abuse and mental health treatment and getting it into the community, I think should be a priority for any incoming health minister.
Thank you so much for those comments. Responding to Troy briefly, Sabrina or Ozzy?
I'd let the former, the newest minister respond to that.
Yes, Mr. Leacock and I have had a conversation in regards to this, and this is something that he highlighted, and that's why it's important whenever we're making this move that we have public engagement, because as he rightly pointed out, this is another element that was never even looked in for coordination and to be embedded in any change in legislation that we are actually considering. And when you look at even when I was the minister, the importance of the separation movement had been started with public health. Exactly what Mr. Leacock is referring to ties in, again, multifaceted, under two pieces of separate and independent legislation that has to be actually covered in two pieces of legislation, so that, again, remaining patient and people-centric, that we are able to cover it holistically. And this is one of the things that we looked for in some of the recommendations that are actually on the table under the Health Insurance Act, where right now, under the current legislation, Sandra, the Health Insurance Commission really has only oversight of the basic SHIC plan. Some of the recommendations that are being considered is looking at having some oversight to monitor with those contracts that have supplementary health benefits. And that's where we're seeing a huge gap. So these are things that we have gotten cabinet support for legal drafting, and then that whole consultative phase, but remaining patient-centric and being able to meet the needs of our community while we're amending these legislation is where the harmonious relationship with the board of directors at HSA from the ministry level who feed up the information. Then you have the mental health council that answers to the minister of health, feeds up that information from what they're seeing, make recommendation. But all this time, we're having situations like this that is happening in real time. As Mr. Troy is alluding to, we need to be able to walk and chew gum at the same time. And that's why it's important that it's just not topical now, but we can show where we're making the steps in addressing these. And it has to be in a coordinated approach.
All right. Thank you very much. Thank you very much, Ms. Sabrina. We do have a number of, we're doing a little catch up here in the comment section. So caller, try to be as brief and direct as you can with your comment or your question.
Yes, good morning.
Good morning, sir.
Good morning, Ms. Sabrina and Mr. Ozzy. How are you today?
Good morning.
Good morning. Good morning. We're fine,
Good
thanks.
morning.
Very good.
Yes, sir. I have one question for Ms. Turner and maybe Mr. Ozzy as well. For years now, the district clinics, they are limited to doctor schedules. And I have asked about it several times or the other. If you all, Ms. Turner or Mr. Borden, either one of you that are successful again, guess you all will be, and you all have anything to do with the HSA. Several people would like to see that the clinics, Borden Town especially, I don't know if you would include Northside as well, to upgrade it, that they could have doctors there 24 hours. They have a little room for the doctors and whatnot, because many times the ambulance is all up. My son used to be an EMT there at the HSA, and Mr. Ozzy knew about that, and he was one of those that went over to the BRAC to train and what have you. He was there as well. But he's in the UK now doing the same thing, thank God, for the HSA. And the part with that, he used to tell me that by the time you get from one district to the other, it was very crucial, for the patient. So, I'm wondering if anything are in plans to have doctors at these clinics 24 hours, that if something happened in Bordentown, they don't have to take the patient to Georgetown, which, could endanger the patient more by the time they get in Georgetown, where they have doctors at Bordentown or doctors in Northside that could deal with this situation right away. Anything that are in place for that?
All right. Thank you so much. Thank you so much, caller.
Thank you,
All right.
Georgia.
So, Ozzy, maybe you having worked so closely with the HSA can answer that question.
And the funding as well. Yes.
Thank you. And thank you, my good friend, Georgia. So, first of all, let me say the 3 Eastern District clinics, Bordentown, Eastern, and Northside, have been completely redone. Not just on the outside, but the interior. They were totally renovated. Bordentown being the biggest one, there's additional services, additional doctor times there. But I think his point about extending a doctor into a clinic on a 24-hour basis is something that the management team, who I'm sure are listening at the HSA, can take under consideration. Right now, we don't have that in place. But what I would like to say, and this is very much on the cards, is there is a new satellite hospital, not the size of Georgetown Hospital, but a new hospital planned for the Bordentown area. This has been approved by the board that I was chairing, and plans are made and being developed for on the right next to the clinic, through the bypass, Anton Borden or Condor, whichever you know it as, the road that goes around the back of the center of Bordentown. There is a site there that was owned by the one area of government, I forget which, but anyway, the HSA has taken over a part of that site. And that was where, when we were in government with Mr. Charles Clifford, and we were talking about Go East, we were looking at developing then an emergency center on that site with helipad and the like. So that same site is there, filled from many, many years ago. And that site is going to be, a part of that site is going to be used to build a new satellite hospital. That is not just something that's a wish list, that's a necessity. Especially that the way I've explained how much pressure is on the Georgetown facility. We need this up-to-date modern facility in Bordentown that will offer full services, dialysis, maybe even a certain amount of operating will be done there, but it will be a fully outfitted hospital on a smaller scale that will allow the Eastern districts access to healthcare. In healthcare, time is of the essence. We all know that. People die because they simply don't have enough. They didn't get there in time.
Okay.
Kindly allow me that we will call them district clinics, and we were actually looking at extending these hours there, and that is why it is a part of the TCC plan that you vote for persons that are alignment. You can see based on the knowledge and the experience that it would be a no-brainer to deal with these issues that we're seeing at hand. We're ready, we're equipped, we're ready to grow and just deal with community projects that has been not, I wouldn't say neglected, because as Mr. Ozzy, my colleague, said, it's not that we didn't start them, but there's a process. And some of the challenges that needs funding, can't say that all of the district clinics will be open 24/7, but definitely an easy win right now is extended hours, and to put the community back into being able to access healthcare will go a long way in preventative health.
All right. Thank you so much. Caller, good morning and welcome to the program.
Good morning. Good morning to you and your panel this morning.
You.
I'm not sure other than Sabrina and Ozzy. I don't know who else is there.
Yes.
Good morning.
This topic is this is Dorothy Davis. You all know who I am.
Mm-hmm.
Yes.
This topic is very near and dear to my heart. I have been angry for a few days now, which relates to family members' issues at the HSA. But before I go on to say that, I didn't hear much of what was said because I just got into the car and then I heard what all this talking about the stress on the hospital and so forth. Anyway, the hospital, I think we have too many. Well, right now, too many people on the island. We just don't have enough resources when it comes to the HSA. You imagine you go to urgent care. After urgent care, I sat in urgent care for 5-6 hours, right? Okay, I'm considered a senior now, and 5 hours excruciating pain in my back and hip. When I did get through, it was after 7. I was there from like 2 o'clock, 2. And when I got through, the doctor handed me pain medication that I had to take immediately. Now, which pharmacist is open after 7 on a Sunday? This is a Sunday, right? There's no pharmacist. So you go to urgent care, you go to emergency room. When you're finished, if you don't get an injection, you can't get tablets or anything from, there's no pharmacy. So I think that's ludicrous. I mean, I don't know, still thinking. Because I think if you have clinics until urgent care is open until 7, 9, 11 or whatever, a pharmacist should be, there should be somewhere to get your meds, right? The same thing with emergency room. So that is one thing. The second thing is that I have these things chronological in, yesterday, my grandson was hit in the head with a rock at the John Gray High School.
Oh my God, I heard about that. I'm so sorry to hear that that's your grandson. Oh my goodness.
Yes, like my 12-year-old grandson. Bleeding profusely. An ambulance had to come from West Bay. The teachers and the police, they were taking so long to get there, right? When they got there, they just, to the mother, it was like they were, I used the word dilly-dallying and asking questions, and the child kept going in and out. He was not, I wouldn't say unconscious, but they say he was kept answering and then not speaking and so forth. Anyway, by the time he got to when he got to the HSA, then, it was a long time, and then they have to do their things and all of that. He was having seizures. He had 3 seizures. He had to have emergency head surgery last night. He's now in ICU. I mean, he was responding well. I'm on my way there to see him now. That is the other thing, is an ambulance had to come from West Bay. I mean, I don't know how many ambulances there is, but we need some other kind of intervention when it comes. That person could have been, and they say they couldn't move him. That was it. They couldn't put him in his mom's car to move him, which I understand that, right? But she was there before the ambulance. All right. The other thing is, my little 3-month-old grandbaby went to the HSA on last week Thursday. Mother took the child because she fell off the bed. I don't know, 3 or 4 months old. I don't know. She's one of those that looks like she's trying to crawl, but she slithered off of the bed, right? And the mother was frightened. She took her to the HSA emergency room because she had a little bruise under her eye and so forth. But she was responding to her and doing things, and sucking her finger and all those things. But she still took her. She was there from 9-something until 12:45. No doctor had seen her. She went through the triage. She was not seen by a doctor. Even the nurses came back and said, "Miss, you're still here? We thought you were here in observation room." No doctor had seen that baby, and she left there at 12:45 and had to go elsewhere. Right?
Okay, I think we get the point. If we can just keep it a little bit short, we do have a number of questions.
Anyway,
Yes,
I'm sending a letter. You don't know who to send a letter to. I know when the past minister was there, she was very, very responsive. I've sent letters to the board, the medical board, which I don't know which file, 13, 16, whatever they get. I don't know. I don't get no response from them. So I don't know. Right now we're sending. I'm sending. It's like nothing might happen to it, but they know the concern. And the other thing is that. Right. Okay. That could go on. But anyway,
yes.
I do know that
thank you so much.
The essence, and those are the things that I want to see how critical they are, and I want other people to know.
I appreciate it. Thank you very, very much.
Okay.
So I hope that she could send that to the board at HSA. I'm sure, Ozzy, if you were there, that would be your recommendation.
Okay. And, I want to say publicly, I'm so sorry to hear that Ms. Dorothy's grandson actually had that incident. But I know for a fact that we were working under, again, while I was there, that funding was actually approved and provided to make sure that we got school healthcare nurses back in the schools. That's something that we were able to do in collaboration also with public health, and making sure that public health itself, even under its current construct, has sufficient public health nurses in order to be able to provide that services. And my heart goes out, but this is why it's important, again, to put the focus back on making sure that healthcare is accessed by all. And for some reason over the years, having those nurses in the schools have fallen away. And that was back in the day by public health, and it was funded. So I'm like we said, sometimes we wish we could snap our fingers and it can happen, but I am hoping that this would be a thing of the past and be a non-discussion topic, where should something like that happen in any of our schools, especially our public schools, that there is a nurse that is there who's equipped, able to deal with the basic needs. And we all know the volumes of calls have increased with ambulance services, and I'm quite sure my colleague Mr. Ozzy can probably share some light on that. But what is important is that funding has been provided to get school healthcare nurses back in all private schools. This would include dental services and expanding it to even eye testing, because far too long we could pick up these elements in our kids as they develop and catch them early, so that in their earlier or later years, they do not become bigger issues if they had been caught while they were developing and in schools.
All right.
My heart goes out to you, and I hope everything turns out well.
Oh my gosh. I heard about that story. Yes.
If I may, Sandra, just before we switch, first of all, again, want to empathize with that caller and what she's just been through with her family. You see, we need to know these things for us to get better. We have to acknowledge when we have faults and we are wrong, and we move on and we develop. I would encourage that lady to reach out to the CEO of the hospital by email. She has email apparently, lizette.yearwood@hsa.ky. Miss Yearwood will direct you to where you can get sorted and also give you feedback on what took place with the family members. We welcome criticism. But I should say, while I was there, we did, and I'm sure we continue to at the HSA. It's the only way we can improve. We are not perfect, as I started the show saying. We have issues, but there's so much good. There's so much good on a daily basis. There's so many lives being saved. There's so many people being helped, and you tend to hear only the negative, but there's so much positive going on. We are now a JCI accredited institution. That happened during my tenure. That is huge. That's monumental for the Cayman Islands. It means that you have to maintain a certain standard, and you review it annually to keep those standards up. Again, kudos to the minister for the support received and the hard work of the board and the management team, who spent countless hours getting us JCI accredited over a 2-year period. We were at that for many, many years before, but the focus had not been put where it needed to be put, and we achieved it, and we were very proud of that. This is why the HSA is winning best of the best awards and all that kind of stuff. And we have telemedicine to the BRAC and Little Cayman. There's things that is going on that is amazing with the HSA right now.
All right, thank you so much.
Patient experience at hsa.ky. Miss Dorothy can, if that's a direct email, patient experience at hsa.ky.
Yeah.
Wonderful. Thank you for giving her that. Yes. So my apologies to that caller. Again, I want to encourage We've got lots of competing messages and phone calls. We do have our two other guests that we're now going to integrate into the show as well. First, let's bring in Ms. Heather Bodden, who is MP for Savannah. Good morning, Ms. Heather.
Good morning, everyone.
Good
How
morning.
are you?
Good morning.
We're good. How are you?
Good, good.
Wonderful. We're going to also bring in Miss Emily Duku, who is joining us as a candidate for, let me see if I get it right. Is it Georgetown North? East. Georgetown East. My apologies. So good morning to Emily as well.
Thank you. Good morning, and thank you for having us.
Good morning,
ma'am. Good morning, everybody. Good morning, colleagues.
We got a full house here, folks. Let's continue to go through the questions and comments. There's a number of them still directed at the two individuals who were with us. Shan says, request to all candidates, please ensure that there's adequate services available to our growing neurodivergent population and all three islands. Hashtag autism awareness, hashtag ADHD awareness. So thank you, Ms. Shan, for that. Debbie says, I can attest to the professionalism at the Smith Road Clinic, specifically of Nurse Price. And big shout out to Nurse Price this morning. She's in the public health section with vaccinations. So I've had some direct contact with her myself in recent months, getting all of my vaccines up to date. And really love Ms. Price. She's a wealth of information. So Strong Wilt is asking a question, and I think it's good to explain these things, and you guys have done a wonderful job so far. Strong Wilt says, good morning, Sandy. Ask Mr. Bodden, why did he resign? I'm assuming they mean from the HSA board. And of course, you have to resign if you're running for political office.
Yes.
All right. That was easy to answer.
To be here with you, Strong Wilt.
Yes. Jerry, good morning. Jerry says, good morning, Sandy, Ozzy, and Sabrina. Mr. Ozzy, are you able to speak to why you now need a referral to make an appointment for an eye exam at the Georgetown Eye Clinic?
No, I cannot answer that off the top of my head, to be quite honest.
Okay, so maybe that's a question we can send over.
Not aware of that.
All right, Jerry, we'll get you the answer from directly from HSA. We'll send that to Miss Lizette. All right, that's what we do here. We get you answers, honey child. Anthony Russell says, rental of space. What are they serious after the millions that government has given that private institution? What a mess. What private institution are we talking about? I don't know. You might want to be more specific, folks. Sure. Make sure we understand what you're talking about. Urban Trends. Yeah, says, good morning. I'd like to ask the panel, what would your group be proposing in regards to health and house insurance? So we're not talking about health insurance, Urban, that'll be another day. We're talking about health. If they're elected back into government, these costs are really through the roof. So we do have Heather and Emily Duku with us, and specifically, we want to now kind of integrate health insurance into this as well. So what is the TCCP looking at as it relates to health insurance? I
will let former minister speak to that.
Sure. Some of the benefits and solutions that we're looking at for this elected group is, first of all, we've identified that there is some serious bureaucracy and cumbersome. It's so cumbersome to access healthcare. And what we are envisioning moving forward is making it a one-stop shop where you can get the vetting process, where you're at the HSA, there is somebody there to deal with their indigents and persons who are deemed medically indigent. When you look at some of the recommended changes, even for the Health Insurance Act, these were some of the things that needed to be addressed by removing a layer of even the bureaucracy that is completely unnecessary for the Department of Children and Family Service. It creates faster help for people, for decisions to even be made faster if they see themselves needing coverage from Cineco. And then it makes the Department of Family, DCFS, provide those data with to be able to make those decisions. We find persons that are needing to be on health coverage for Cineco on longer than others But right now it looks as though everybody is either getting 3 months or 6 months. And sometimes the renewal process is like they're starting over again while they're waiting for well-needed medication, and they're found with these challenges. So even with some of the recommendations, when we looked at amending the Health Insurance Act, definitions was key in order to avoid the bureaucracy that people were facing, and again remaining patient and people-centric, was why the former Deputy Premier and I, Mr. Andre, who was the minister responsible for NAU services, collaborated in making sure that we could get our indigents and persons who are medically indigent into the services as seamless as possible, and even those having mental health issues. When we look at the definitions under the current legislation, there was needing a consistency in even the definition of a child. When you looked at the whole definition of a healthcare facility, what is that? What does it mean? And it is very important that we start with getting the data first, and definitely we know we have it, but making sure that HSA is equipped. We know what services they can provide, remove what they can't provide, and once you identify what the needs are, that the seamless process for those healthcare services available adequately on island, that the patient is not tied up into the crosshair of this department talking to that department, that we have an integrated system, that the patient is getting access to care while we're dealing with all the back end admin work that is not disenfranchising the patient who is actually needing the care.
Okay. All right, let's move on to another question or comment. Selvin says, glad to see Mr. Bod in the race again. My interactions with him have always been rewarding, and I wish him well.
Thank you, Selvin.
Yes. Lee says, I definitely have seen some changes with HSA in their service, even at Women's Health. And in the labor ward, nurses are very professional and helpful. Jerry says, thank you, Sabrina, and reiterating on the desperate need for mental health facility that can accommodate all mental health patients. I have a 65-year-old schizophrenic brother with chronic health issues, and I was told that he was unable to be put there due to the physical health, to his physical health, my apologies. And the Pine said no due to his mental health. So again, we find that there's this conundrum of patients who, don't have the access to the facility,
Sandy,
even in a point.
Sandy, what I would like to say, mental health has become a real, especially since COVID, but even before, it's become a major, major issue in this country, right? And we have to put resources where they are best belong. This government will have the task of sitting and looking at a budget and reallocating funds where they are best served. The health of a nation is the wealth of a nation. And if you do not prioritize health care, you run the risk of a very, very sick society. And you think you have permits now, you'll have a lot more because we'll all be gone. We need to take care of our people. We have to make it affordable and accessible. And one of the great things that is about to happen in next month, actually, is, although it's not something that we wish we didn't have to do it, but it's going to happen because the HSA recognized it, and we're putting dialysis in West Bay. Former Minister Turner knows this. She was very supportive. And again, we are expanding services all the time, but it takes money. And if you push money at needless projects or private egotistical projects, I should say, as ministers, you don't get anywhere. You have to work as a proper government together, not in silos, and ensure that you get what the country needs. Someone put up a question, I noticed it earlier, Sandy, you missed it. It was Mr. Barnes. He asked, where would the funding come from for the Bottom Town Hospital? Yes. Well, this is what I'm talking about. You have to make sure that your budget is right. The HSA will budget for that once the funds are available. So just wanted to throw that out.
Yes, no, we've got to.
There's a lot we recognize, and as
Yes.
a community, our focus is on community, not on individuals or silo thinking.
Yeah, we've got a number of questions around the budget, and we know that Heather, has some limited time this morning. So Heather, if I can ask you to speak to your specific area before you have to go, which is in relation to dealing with a lot of our seniors. So we know that you have always been very, very involved in the senior community, particularly in the Savannah, Newlands area. But what are you seeing as some of the specific concerns and needs from the perspective of seniors as it relates to our, just our priority areas within their communities?
Good morning again, and good morning to everyone that's listening. I just want to say that I'm honored and proud to be a part of this team that's working towards making the lives of Caymanians and people who reside in these islands a lot better. We want to make sure that our seniors are living their lives with dignity. Everyone who knows me, they know that I'm particularly concerned about our seniors. I mean, that's a passion that I have. Our seniors are aging in our area, but thankfully, they're being taken care of to an extent. And we're extremely proud of what we do within our office here in the Savannah community. Our seniors have laid the foundation for us, and I have always been one that have just taken this on and just been so happy that we're able to do things with our seniors in regards to making sure that they're receiving their medication, they're getting their health checks. And I also concur with whoever is responding in regards to the clinics in our area. Boddentown, Northside, East End are very blessed and fortunate. But having the one that we have in Boddentown, it seems to work for us, especially in the Savannah Newlands area. I must send a big shout out to Miss Thelma E. Banks. Without Miss Thelma and the Boddentown Clinic, I don't know what we would do. She's extremely, extremely passionate about seniors as well. And anything that our seniors are needing in our area here, we contact Miss Thelma at the Boddentown Clinic. She then liaises with the HSA in Georgetown, and medication is sent to the Boddentown Clinic. And she will actually go out of her way to deliver the medication to our office, or she will hand deliver it herself. But yes, we are passionate here, and we do take care of our citizens in this area.
All right. Thank you so much. I want to remind our listeners that the focus area today, I see some of you asking about housing and other things. The group will be coming on between now and Election Day, talking about specific, just to keep the conversations really sort of structured and guided, if you will. They will be talking about specific things. So today it's health and health insurance, and they'll get to some of those other discussions as well. So we're continuing to go through the questions, so please bear with us. Sabrina Albert has a criticism here. He says, thanks, Sabrina, for what? Being a quitter, what has she done for mental health? So I think you've already answered this question, but certainly if Albert joined us late, he's welcome to go back and listen. But I think this is you might as well, I believe in addressing these criticisms head on. And this now, we even see a signage that has gone up in the yard of Mario Rankin in Newlands, where he says, we don't want quitters, right? You're one, as well as Ms. Heather, so I'll let both of you address this, who he's referring to, I suppose, in that you left the last administration, the UPM administration. We know, Ms. Sabrina, you were a minister of health and wellness, and of course, Ms. Heather was a consulate. Tell us again, people may have missed when you gave this explanation at the Seafarers Hall. What do you say to people who want to call you a quitter? No, just unmute yourself. Sorry.
Sorry about that. This is why it's important that we get it right this time around. And it is important that we are able to elect a group of like-minded persons, have our priorities at stake. And it is in our constitutional right that if you are not able to to go along with collective responsibility, as we have spoken about on this forum, that you have under your constitutional remit the right to remove yourself, to resign from your role as a cabinet minister, which is what I've done. And for the reasons given on previous shows and at the Seafarers Hall, that was a decision that was not likely. It was not taken lightly at all. We understood exactly, and speaking for myself, how important that was, having been given the first time opportunity to serve the people in this noble role. And for the reasons that have been stated on your show and in the public's domain, it's something that I would do on the principles of who I am as an individual, and for respect of just moving forward and serving the people. But you need to look at why it's important to serve with a group of people that has a collective mindset. We can deal with it and prioritize the issues. And as my colleague, Mr. Ozzie, said, we have to prioritize the needs of the people. And even though you may have single member constituencies and people are electing you based on what they say you are capable of doing and deliver, there is a process that has to be taken, and you have to fight for adequate funding. Going back to the topic at hand, what have I done for mental health? Earlier on in the show, I explained that there was legislation that was inadequate that's dating back from 1976. I was able to address the Pharmacy Act, got that passed on the floor of Parliament. I was able to address the Mental Health Act and mental health regulation that is constantly needing assistance, that has brought out a lot of other issues, which is why I started and I got legal drafting approved by Cabinet to deal with health insurance in the act for that, in order to be able to expand the services and access to putting the people first and foremost. But we have to be able to work cohesively together, listen to the people, be able to deliver. But I feel we almost need a show where we have to understand and make it clear what the roles of a minister is in the elected arm versus the roles of working together with the civil service, councils and boards in order to deliver for the people. Because many a times you feel that, oh, you're a minister, what can you get done? I will reiterate, as the former Minister of Health and Wellness for the first 2 years, was inundated with regulations to take us safely out of COVID. And I think that people have forgotten that. Let's take a step back. It was after the dust settled that I was able to bring the pharmacy bill to the House of Parliament that was woefully inadequate from 1976. And then I still amended a piece of legislation under the Mental Health Act, because we heard that mental health was at the forefront coming out of COVID. And then I immediately started working on getting the removal and acts for public health, environmental health act, and like we said, the health insurance act. So there are approximately 5 pieces of a legislation, including the national health survey that we did, the STEP survey, clinical standards for our country, while dealing with all the boards and councils. So what have I done? I've done a lot. And I'm quite sure getting it back on topic for our primary focus and our my new colleagues that have joined us, to let them explore and share with our listening and viewing audience where they tie into this whole role that's topical to medical insurance, access to healthcare. Miss Heather has worked closely with her seniors. She sees the needs. That is why we can no longer work in silos. That is even as a minister, various government departments, private and public stakeholders. Emily has background based on all of the councils that she's worked on and volunteered with working on. She has a hands-on in understanding the importance of mental health. So being a quitter for the grounds in which I did it, I can stand on my own 2 feet and say, I am proud that I did it. I stood on principles and I would do it again.
All right.
And I'm gonna
Miss Heather?
I'm gonna follow her and say I didn't quit. In fact, I got back on the road as quickly as I left, and I stood up for what is right. Trust me. And I stood against bad behavior. But I'm no quitter. I come from a family that I've always been known for hard work. And trust me, I just find myself enjoying what I'm doing here in the community. And it's something that I'm very passionate about. I don't think people have to question what I have done. It is something that I take great pride in doing, as far as standing up for principles, standing up for you know what I was put here for, to serve, and that's what I am doing. I didn't appreciate bad behavior, and I would not accept bad governance. So trust me, I just felt like what I had to do was within my heart, my soul, and my conscience, and I followed that.
All right. And somebody said that your slogan should be, yes, I quit corruption. Yes, I quit side deals. Yes, I quit disrespect to women. Caller? Yes.
I'm doing what I'm doing from my heart. Trust me.
Yes. All right. We do have a caller in the line. Good morning, caller, and welcome to the program.
Yes, good morning.
Good morning.
Between the two former ministers of health, is a lot of health resources. And in relation to the HSA, I'm wondering, I know there was a drive some years ago to collect outstanding debt to the HSA. I'm wondering how that has been, and what do the two former ministers of health think about linking non-payment to accessing the individual pension to satisfy that outstanding debt? Thanks.
Let me ask about the last part. Oh, sorry. Did you guys understand the last part about access?
I understood some of what he was saying.
Okay, all right.
About linking non-payment to their pensions, but that's
I'm not sure that's a good idea.
I don't think that's a wise idea.
Okay.
What I would say is that we've had to, as a board and management team, we've had to write off a certain amount of debt, and after a while, you know it's just simply uncollectible, or what it's going to cost to collect it is not.
Is it going to be worth it? Yeah.
Right. So what we put in place is a better system at the front end to ensure that people are covered. Those that aren't covered, then of course they're covered under the ministry output. But those who come here and they have insurance, our reception staff have to do a better job and make sure that they get all of the information that you need to be able to bill those people in the end. And we found there were gaps there, and that's been plugged, I think, in large part. And that is an ongoing process to avoid the bad debt in the first place. But there are people that will have to be carried by the state, and eventually, if that is for whatever reason, it will have to be written off, because it's a cost of the healthcare of the nation.
All right. People don't often understand the cost of doing business, but it's a fine line, I think, for public administration, the cost of doing business, and then also trying to provide services, which, it's not exactly a business model, but you've got to find that sweet spot. Emily,
it's not one of them that you can say, I'm not going to take care of you, go somewhere else. You got to take care of them.
Yeah. Emily, let's have you join the conversation. We know in relation to this topic, you're going to be discussing some mental health elements and obviously our youth. We have Natasha with a very interesting, prognosis here. She said that she'd also like to add that as an adult, newly diagnosed with autism and has had an ADHD diagnosis for years, there's very little support. There aren't programs in place and people to help walk you through your rights and what accommodations and programs there are to support you. So, Emily, a lot of our listeners, I think this is actually your first time on the program, so let us do a super warm welcome to you. But perhaps, we have a sink or swim model here. As you can probably see, we just throw you in on the deep end and you start swimming.
I can swim quite well. All good. Thank you, though. I love to free dive, so I think it's just fine. But I just
perhaps you could talk about this issue.
Yes, definitely. And health and healthcare and health insurance is such a multifaceted issue. from my perspective, I can relate to a lot of what our young people in particular are experiencing when it comes to their mental health challenges that have only increased since the pandemic. And it's health in and of itself, and how do we holistically address it? It's a bit of a sticky issue, right? There are so many layers when it comes to quality of life, sense of belonging and fulfillment in our communities, as well as what issues people might be experiencing from childhood that have been unaddressed and that they're trying to navigate as adults. To Miss Natasha's comment just now, I want to just share that I'm not speaking on behalf of them, but I do know that there is a local nonprofit, Inclusion Cayman, that would be able to point you in the right direction and offer support for your diagnosis with autism. And as a person who has a brother with autism, I can understand the challenges that parents of children with disabilities and family members with disabilities have. And there's no greater shame than the lack thereof of holistic support for these members of community. But I can assure you that it is a priority of the TCCP team to where, long term, we put the we put the care back in healthcare. And, community equals immunity is something I strongly believe in. And I know that we believe in, and bridging those gaps and filling them in ways that people feel, like I said, that sense of belonging and dignity in our community, to where we're efficiently finding solutions that address a multitude of issues, so people's quality of life can improve. People can have greater access to healthcare that's tailored to them, because as you'll hear in the healthcare field, there's no two patients that are the same, right? So we have to take that considerate approach when it comes to people from if it's just your average person who wants to just get their annual preventative checks, to persons with more complex cases, there are support systems in place. So they only have to worry about what they're going in to handle, right? Which is their health, their child's health, or their family member's health. They're not thinking too much of, how am I going to afford this? And will I have to, potentially not pay a bill in order to not go into debt or remortgage my home to, cover some major health cost. But to kind of circle back a little bit, as this is my first time on the Cayman Railroad Show, I tune in quite regularly, and I'm grateful for the platform you offer. I do want to just take, if I may, a moment to just introduce myself, speak a little bit to my values and my concerns with the community. So I am a proud Caymanian. I've got very deep ties to West Bay. My mother is a Rivers, her mother and her grandmother were Ebanks from Bosun Bay. Many of you may know my great-grandmother, Miss Merdine from Bosun Bay. And growing up with my grandmother, my great-grandmother's profound insight into how they were brought up, and the brought-up-see I was instilled with, and understanding how they took care of their health. Oh yeah, man, how they took care of their health and navigated those days where it was just bush medicine, and you did the best of what you could. And it's night and day from when they were growing up to where we are now. But there are still a lot of gaps that need to be filled. I'm glad to see that we haven't remained stagnant. We've made a lot of progress in the last several decades, and most notably a lot of progress since the pandemic, where we understand that this is another layer, right, that we have to take into consideration and keep at the forefront of our minds. So, when it comes, one of my values personally is actually health, safety, security, community care. These are my personal values that I bring to my professional opportunities and work, which includes working with a number of nonprofits in the last 4 years. Many people might recognize me from Amplify Cayman or Sustainable Cayman. They might recognize me from the roles with the National Trust for the Cayman Islands. And I've done a lot of work with young people in the last few years. I'm a proud ally of the LGBTQIA plus community, who worked with their members of that community who are younger and help provide safe place for them to express themselves authentically and confidently, while understanding that that community, as well as the community of persons with disabilities, have added challenges that we as a community have to do our best to ensure that they are adequately and equally, equitably cared for. Right. So, several concerns of mine prompted me to run for office in the first place. Right. I ran in 2021 initially because I felt that, there was a lot of focus on development and not making sure that our community kept up with that growth. So was prompted to run then, and this is simply a continuation of that journey that started in 2021 that I'm very proud to be amongst my esteemed colleagues. To where, teamwork can make the dream work for our people. We really take community seriously. It's in our name for a reason. And we want to make sure that our young people, feel cared for. Ms. Sabrina and I had a wonderful conversation with some young people from UCCI a few weeks ago, and we understood some of the challenges that they're navigating when it comes to balancing their education with, home life and their mental health care. And so, I think even if we didn't have those conversations, we would still have a deep sense of empathy and drive to find solutions.
Thank you so much, Emily, for that introduction. We do have some additional comments and questions coming through, and I know we're playing a little bit of catch up here.
I know you a lot better now, Em.
Yes. Orlando has an interesting suggestion, Ozzy, saying that maybe you should just run as an independent. The script from your colleague sounds too familiar. What do you say to people who say to you, run as an independent? Why are you running as part of a team? And specifically, why are you running as part of the TCCP team?
Well, first of all, thanks, Orlando, for his faith in me. But I have seen what a group of independents ended up with the last time around. People who were crying for independence. Before that, I was a member of a team, PPM. I started my political career as an independent by my little self in Town, and that didn't go too well against the big guns. I joined up with the PPM in shortly after the coup. Back in 2001, I ran for the first time in 2005 with them, was elected, and they came back, and I ran again in 2009 and was elected and became a minister. The benefits of the party system, there's no doubt that there is a great benefit. What it does, it brings structure and organization, and you, the voter, knows what you're going to get. We have to present you with a manifesto after sitting in our meetings and coming up. Everybody on this team has their own mind. I can promise you that. There's no domineering force in the TCCP. And I made that clear from the get-go when I sat down and spoke to the leader, Andre, and with Mr. Panton. I said, guys, there has to be equal opportunity to express and have a voice in this team. You are assured of that. I said, good, we can start from there. That is important because if I'm no stooge and I'm no lackey for anybody who knows me knows that. I bring a lot of experience to the table. I bring financial industry, I bring healthcare industry, I bring businessman expertise, and along with all of my school training long before that for accounting and insurance and the like. So I've reached this grand old age of 63 with a bit of wisdom, thank God, and with God's help, I feel to offer the good people of Bontown West a good term of office. And therefore, I was looking for the right group of people of like-mindedness in terms of community and wanting to just back off some of everybody cries out about this fast pace, this train wreck that we're on, that Cayman is developing so quickly that we're leaving our people behind. Back in the 90s, when I was a college student in the UK, I wrote letters about this. I saw it from them. We were just not preparing our people to keep up with the development of our country. And that has driven me over the years to want to be a part of the change. I don't want to sit down in my rocking chair in my hammock one day and say, you could have made a difference and you did nothing. When good men do nothing, evil prevails. And I can tell you, we have a group and it's growing by the minute, because by the end of this week, early next week, you're going to hear of 3 more people that are on board. That's going to bring us up to 10. Shortly after that, another 3 is going to bring us up to 13. The TCCP is a dynamic organization filled with people of ability, of varying strengths, and with diversity. When we reach 10, we're going to have 5 women and 5 men. Never seen before in this country. That amount of women sitting at a table, coming forward to run for political office on one team. That in itself tells you that you are going to have and you're going to be properly represented when you elect the TCCP on April 30th.
Yes. And let's speak to this, Ozzy. Debbie says, go through, Ozzy. Just take your cow card with you. And of course, Marshall says, don't forget, he also brings the cow card. You'll go down in history for a couple things.
The cow card is the mouth now.
That will definitely be one of them. But let me say this as well, as someone who's been involved in the formation of a party, the Progressives at the time, and I know you were there from early on as well. People have a lot of misconceptions about parties, especially if they've never been involved in a party. They've never, been on the ground. The one misconception that you just clarified is that there's this idea that a party is of a singular mind. Now, we have seen some parties that appear to operate in that way, so it's not very much of a democracy. It's almost like you want to sing that song, Follow the Leader, right? There's the leader and everybody just toes and follows the line, and there's no dissenting opinion. There's no opportunity for people to come forward. And I want to point out something that maybe is not as obvious to our listeners this morning and our viewers of this program, but they should pay attention to. We have candidates here who are here by themselves. There is no leader as such this morning, right? Mr. Andre is not here. Wayne Panton is not here. They have put forward and pushed forward the individual candidates that are the team members of the TCCP, I think with a view to say, hey, you guys have the relevant experience that, our voters are looking for. You can speak for yourselves. Go out there. Here's the topic. Let them know what you bring to the table. We've got Sabrina, who has her experience as a former health minister and professional as well in the health profession. We've got Mr. Ozzy with a wealth of business experience, and he has also served as health minister in other ministries, and most recently as chair of the HSA board. We have Miss Emily, who has some professional experience, and she also is here speaking on behalf of youth and that marginalized group of individuals who are oftentimes, just not, they're disenfranchised, to be honest, which is a lot of our mental health and specific to youth and mental health. And of course, Miss Heather with a strong voice when it comes to the seniors in our community. So there are benefits to the formation. I saw somebody else make this comment about, how is this going to be any different? I think that was Erwin here. Says, morning TCCP team. Thank you for being here. Question, if all of these TCC folks only recently united as a party, why should Caymanians trust that they would stay together as a party when the previous last minute union could not? And I think in his question is the answer. You said yourself, Erwin, the previous last minute union. So the distinction, folks, and take everything obviously with a grain of salt, but the distinction here is you have people who are coming together, who are having conversations at the onset, beginning before the general election. They're not in a crux situation after the election where they're being forced to come together for the simple and singular reason of forming a government. Exactly. They're having the ability to think about, and I know that these discussions are happening across the board with all of the parties. They're having the ability to think about who already is part of TCCP. Do they align with my core values? Will they allow me to be, an individual that still has a voice, that can bring unique contributions to the team is the leadership that I can respect. Have they demonstrated a history of respecting women, of just respecting seniors in our community, of working, with our youth? So all of those things matter. And Erwin and others who are like, well, maybe look at other parties or whatever, ask yourself, why has Aussie chosen this party? What's unique and different about this party? The PPM has been around for 20 years, and they are the weakest that they've ever been, if anyone needed to be honest about the current situation. And Aussie, obviously, you want to be in a winning team. Let's be honest. That also matters and also counts. But, also a team of professionals, people who have tried to bring the best of the best, and not people, listen, for all of their wins, the PPM has no succession planning. They have had a mass exodus of people right now that are resigning, and they did not have a succession plan. And you can see that because they're scrambling. David White just said he's resigning and nobody to take over from him. There's no youth arm to the progressives. They haven't trained anybody up in the ranks. So that, Erwin, should answer your questions. And even Orlando, why would he want to join a team that has demonstrated they don't even understand the concept of successive planning when they've been around for 20 years? That doesn't make any sense. They're bringing newcomers in who have no experience whatsoever. They've not helped the party. They weren't even party members before the last week. And so those things are things, if I were a candidate, those would be some of the things that I would definitely be looking at.
And let me make it clear that it is, it is the silly season now. The TCCP has declared and supported one leader, and that one leader of the TCP is Mr. Andre Ebanks. And as we continue to build our party that has pretty much came into existence, not 2-3 years in the making. We're talking from the 1st of November. We're not about just to get us late for numbers. We want to be able to work and get a bunch of persons who are of the same mindset, pretty much listening, that we can work together and independently come together, make a cohesive decision in the best interest of what's good for our country and our people. Even though you have a leader, that's where the structure comes in. You build your relationships from there. As an incumbent candidate for the constituency of Prospect, remember I ran as an independent. Now, got elected, and here I am now with a party that is building or has started building from the 1st of November. Where we're coming from in pretty much 3 months, if not just a little shy of that, given the exception of the Christmas holidays. And here we are, and we're ready to roll out the additional slate of candidates. Should speak volumes of where we are. But to just make it clear, we have one leader of the TCCP, and that is Mr. Andre Ebanks. But individually, we all are appreciated, and our suggestions, our contributions to this party and the way forward, invested in that manifesto of where we're going to take this country, is not in isolation, but no dictatorship style. We all are valued, and what we bring to the table is appreciated and welcome, and we will roll that out cohesively at a group, and that's what's important.
All right, we do have a caller on the line. Good morning, caller. Welcome to the program.
Good morning. I've been waiting.
Yes, ma'am.
Thank you, everybody, and especially my beautiful Sabrina. But okay, I want to make a little comment on the HSA. I want to know I am fair. If I get good service, I sell good. If I get bad, and I must say, yes, the service has improved because I had ambulance recently.
Yes.
And going was a different set of crew. It was very good, excellent. I would rate it 200%.
Yes.
Coming back was a different team, and I'll rate that 500%.
Yes.
And I have 2 procedures that I gotta go do at HSA today. And if I get good, I will be reporting good. If I get bad, I will be reporting bad.
We know that. We know that.
Coming to me now, I am a senior. Right now, I have 2 prescriptions at the Smith Road facility. Marie less than a week. I don't drive. I have a bad knee. I need to get surgery on it from last year, and I'm debating it. I got a broke back in 2018. I got a sick husband, and I can't get my medication. So I would appreciate if they're picking up medications, I can call and I am right out the road from them. I would appreciate since the city takes care of the seniors from Savannah and Newlands. Well, I am a Newlands senior. I've been up in here from the year 1985. I am 70 years old now, so if that's not considering I'm big enough, old enough senior, well then tell me so. But I go in today and try to get it myself when I go down. But I always have prescription and I have to be juggling other people to get it. Sometimes I get turned down because this medication I've been supposed to have complete this because I'm waiting on the results of what I'm going to do today because I might have to do a procedure and I'm not get the medicine yet. And the doctor recommended about over a half a week now. And it's right there. I hope when I go get it today, there.
All right.
So I don't know which seniors they're assisting.
Well, can we have Miss Heather then just to reach out to you, Miss Heather? I'm sure you have Miss Norma's contact details. We'll have her reach out to you.
That's 48 7 I can get out there, so I am not one of the appreciated seniors. I guess I'm too black and my mouth too big.
All right, my dear. We'll have her reach out to you. We do have limited time and we are in a little bit of overtime. And I've actually got a 10 o'clock appointment in town as well today. So we're going to start to wrap things up here. Moya has a question. She said, a good question is with everything that is sparking off with the U.S., should things escalate and tensions rise with the U.S. and the U.K., what channels or jurisdictions would we look at securing should we not be able to air ambulance critical patients to the U.S.? So the U.S. is in a bit of a tumultuous situation. It could last for 4 years. Ozzy and Sabrina, perhaps you're best suited to answer that question. Any thoughts on this as yet?
I'll take a first jab at it. This is why it's very important that we identify what resources that we have so that we can have sustainable healthcare, build in the necessary MOUs for what we actually have to make us a resilient jurisdiction. We see what the amount of services that we actually have here on island. We see the improvements over the years of our public hospital at HSA, knowing that we had an issue where if there was ever any shortages in even being able to access oxygen, we are now able to produce our own oxygen at the HSA. One of the big things that was critical during the last pandemic, and I'm hoping that we won't ever have to go through that again. But what we're saying over the years, as we have evolved, the necessary infrastructure services to make us a more resilient, being able to provide those needs in critical cases, that we're able to sustain ourselves for an extended period of time. We look at what resources are available in the private sector, and we build those relationships that gives us that ability to be able to provide continuum of care if it is not available adequately. When you look, yes, at what's happening regionally and USA and Canada, our neighboring countries, our brothers and sisters in the Caribbean territory as well, could be able to offer services as well. That dependency on the US and let's say Canada, we need to look further afield as such, but also regional can be taken into consideration. But charity, I must say, this is a strong line of mine, begins at home. We need to honestly appreciate what services we have here, look at our standards and of the national health standards and clinical standards, making sure that we have the necessary legislative frameworks and the oversight and bodies to make sure that you hold these service providers accountable for their action and maintaining that sort of standard, and being able to be to sustain ourselves in the event that actually has to happen. We look regionally and we see how much people are coming to our shores for medical tourism. That should speak volumes for our jurisdiction. So I feel that the steps in which we have made, and I'm quite sure my colleague, Mr. Ozzy, can say with some of the improvements that he knows has happened during his time, that we are in a much better place today than we ever was, even looking back 5 years ago, with what improvements we're making. We're looking and highlighting the careers that are in the healthcare industry. We're looking at the nurses, making sure that that's a shortage globally. And we have a Cayman Islands School of Nursing that was renamed recently. And, we will continue to fund that. And this is why it's important that the right persons are elected, that you can prioritize and make sure that you can get adequate funding, because we see where healthcare, mental health, getting access, affordable medication is key, but also legislation surrounding those. And sometimes it can get very, very heated. It is very topical. Public engagement, data-driven, is also critical. And I feel with the right set of people at the table, this can definitely be achieved.
All right. Quick comment. I have known Mr. Bodden for many years. I wish him success in this election. I'm extremely proud to have him as my representative of Bodtown West. He will work for the community. Orlando says, I agree, Carolyn. Ms. Joyce Sand reminding us that MP Andre took us off of the gray list. And I should say that was in strong collaboration with Mr. Wayne Panton. He silently worked with the minister, Andre, and his team to ensure that collaboratively they were able to make that happen. I think a lot of people don't necessarily know that. Can we get 2 quick responses to these questions, and then we got to run. I've got a 10 o'clock in town, and I don't want to be speeding on the roads, honey child. Gabby says, any updates and if we were able to start doing organ transplants this year? So where are we with that, Sabrina? You might have an
definitely
idea.
The legislation, which goes back to what I was alluding to. There's a council that definitely deals with that, clinical standards, and the MDC and Health Practice Commission, these are still ongoing. I know that the group of people that are dealing with transplants, how this country deals with that was feeding information up to the ministry so that we have the necessary legislative framework in place to make sure that we're doing this at a safe standard. And where I left it is that there was ongoing works, but to say this year, it would be a bit premature for me to speak out of turn, not being a current minister at this time. But I can assure you that it is something that is ongoing works and will come to fruition for sure, because we have a great bunch of people on that council that is working to definitely advocate for this to happen safely in our country.
All right. WhatsApp comment says, I just want to say some of our people expect too much from the MPs and the government. Getting medication, getting to and from your appointments. Do you not have family members that can assist? What happened to family? Interesting question. And one final one, Ms. Nola wants to know, can the former health minister tell the Cayman Islands why the public health department wasn't established as promised?
Because we realized that we needed a standalone public health act, a public health legislation, in order to have been able to separate it from its current construct being housed under the HSA. And when we looked at that, we saw where that was far reaching over other pieces of legislation that also needed to be updated. So that somewhat hindered the process, but it is not off the table. Should the good people of Prospect re-elect me, it's definitely going to come to fruition, because what has been spoken in the public domain with stakeholders, they can see the need for the separation of public health to be a standalone entity. So I'm all hopeful that this will happen, that the TCCP team, of course, this is very topical for us as well, will be re-elected, and we can hit the pavement running and bring that to a reality. But I know some of my colleagues have other commitments. So do you. I'm quite sure. I'm sorry, but welcome. I know we will be back on your show again on CMR.
Absolutely.
But I just want people to remain focused and just make informed decisions. Get to know your candidate. But the TCCP is committed to putting our people first. This is not cliche. It's not just topical. You can see the dynamics. You can see the uniqueness in each individual from this group of persons who have come out publicly and say, we are proud TCCP candidates, and those who are about to roll out. And, the health of a nation basically is the wealth of a nation. I have said this, and there's no politics. There's no room for politics when it comes to health, safety, and education here. But, we just want to make sure that we get the needs of the people right, that they're no longer feel as though they're no longer heard, or that they're looked at less because they may have fallen short on their insurance. We realize that there are gaps, and as a cohesive group of TCCP candidates, these are some of the things and much more that we will come back on your show and discuss at length as this season progresses.
Sounds wonderful. Thank you guys very, very much. Again, folks, TCCP, every Wednesday now, they're going to be here leading up to the election. We had Sabrina Turner, representative for Prospect, Osborne Bodden, running for Bodden Town West, Heather Bodden, current MP for Savannah, Emily Ducoup, running for Georgetown East.
Sandy, if you could allow some closing comments, I'm sure the two ladies would like to do, and I'll wrap up.
Yes, as brief as you possibly can, Ms. Heather and Emily, go ahead.
Yes, Sandra, I have a Public Accounts Committee meeting shortly, so I'm just going to end up by saying that I want to address the misconception that some may hold. Throughout my life, I have never been a quitter. At times, tough decisions were made that were rooted in my unwavering commitment to the future and the leadership of these islands. Those moments were not about stepping away, but stepping up to ensure that the right path was taken for the greater good. No matter the challenge, no matter the odds, I have remained steadfast in my dedication to doing what's right and standing by those I serve. I did not quit my people. I quit bad behavior and I quit bad governance. And thank you all and have a good day.
Thank you so much, Ms. Heather. Appreciate it. Emily?
Thank you, Ms. Heather. And just in closing, I just want to, stress that something that is not only a personal concern, but also a team concern is overall socioeconomic justice, of which health is a component, and ensuring that we make decisions that are efficient with our resources, which includes ensuring that, our environment is conserved, as that plays a huge role in people's health and mental health, and is one of, as a topic very near and dear to my heart. And, ensuring that people have access to culturally relevant solutions that factor in where we came from, what our vision is to where we want to get to, and ensuring that the transition is as seamless and pain-free as possible for our community is something very important to the Caymanian Community Party and its team members, who all take a very dedicated approach to ensuring that we see these solutions come to fruition for our people.
All right. Thank you very much, Emily, and have a good day. And we've heard lots from you too, so I don't know what more you have to add, but let's leave it there.
Well, I'd like to close by saying my life has been community, 45 years of community service. And in various service clubs, district level, government, and even in my business, I support the community. I believe in community, and that's why the community party is so important. The TCCP, to me, is what we need at this time. We got to focus on our people. We got to give Caymanians hope. We got to give Caymanians opportunity, and that is what this party is about. We're not all with the same brain. We come to the table with different attributes, but together we're focused on that. And that is what is important. And we trash it out at the table. We come forward to you, the public, with a unified voice and promises that we intend to keep. A party has to have a structure. It has to have various mechanisms within it, as you know, Sandy. And this is where the PPM went wrong. When those started to fall away, the youth arm, the women's arm, and all of the district stuff, we have to come back with our district. We got to get our district councils functioning. We got to create them first of all, and let them function and keep us in touch with our communities. Let our community bring information to us. We take information back. This is what representation is about. I do not take this lightly. When I take this on, I take it on as a job. We receive money. Yes, for our time, but most of that, as we know, goes back out to helping people. We are here to serve at a great sacrifice of ourselves, sacrifice of our families, and we ask you to look at the TCCP as the most viable group of candidates to lead this country going forward for the next 4 years. I'm having a breakfast event on Saturday morning. The people of Bontown West, please come out, enjoy, meet me, talk to me, share ideas. We don't know, we don't have all the answers. We don't know it all. We're not here like that. We're here to hear from you and absorb. Like that question a while ago from the lady Moya about air ambulance. And I honestly, that amazing. That's a great question. We don't have the answer to that right now, but it's something that would be taken on board, I'm sure, as to what happens if, you know, everything goes, you know, to hell, as it were, in the US, and we have to look elsewhere. Well, then we have to have backup plan. Excellent question. And that's what we're here. We're here to learn as much as to talk. We can only express our wish to serve. We are good people. We want to serve you. We understand you. We understand the issues, but we don't have all the answers, folks. Give us a chance.
Thank you very much. And of course, let me go ahead and thank both of you again for coming on the program. And I'll go ahead and pull you guys out and just do a quick reminder to you that some events coming up. So Miss Sabrina has a yard meeting on the 13th, which is tomorrow. So this is Thursday evening from 7 to 9 p.m. And that's going to be at Mr. Winston's yard, which is 15 Tidewater Avenue there in Prospect. So come out and join her for that. And she has a very active office that has been open the 4 years that she has been in. I can tell you, her young lady there, her name escapes me at the moment, but she does a phenomenal job in the office if you've ever had a need to contact her. And of course, Ozzy just mentioned that he's having a community breakfast on Saturday at the Lemuel Circle Park in Northward from 8 a.m. until 11. So he's also inviting you out to his event. So 2 events scheduled for this week. We posted them on social media. So perhaps if you're able to attend those events, you can. Listen, folks, it's election time. And I've made it very, very clear that the candidates that you will now see on the program are candidates who are here paying for the opportunity to reach Cayman's largest audience via this talk show. And we give them that opportunity. You know, I'm trying to give them a chance to answer as many of your questions as possible. Obviously, so many questions, you know, have come through. We didn't get to all of them. My apologies for that. We do try to give the phone calls a priority as much as possible as well. Gabby says, we love you, Miss Heather. Hashtag TCCP. Donette says, love you, Sabrina. You're a down-to-earth person. God bless you. Jane says, good example of what we need to hear: good governance, concern, and wanting to serve the people. Anthony asking if you're going to be getting fried fish. Yes, sir. Wouldn't have to buy lunch. Well, that's another business. So I'm not too sure about that. But you know, I applaud them for even coming on, because they know they're going to come on here. They're going to have to answer some tough questions. You guys are going to call in. There will be critics who, like Orlando, well, we don't think you should run with them, this, that, and the next thing. You know, everybody is going to be entitled, certainly, to your opinion. I'm just here more or less as a moderator at this particular stage. But I also want to encourage you guys to come with your good questions, but come with fact-based questions. So, you know, Orlando, I don't recall ever seeing you on the program before, so welcome. But this comment that you've made, this is where now I have to step in and say to you, you know, you made a comment that I will address this morning when you say, oh, you're disappointed with the interview. Well, you don't have to like it, I suppose. That's a matter for you. And then you go on to say, when your favorites are vying for power, suddenly we're asking too much of government. So let me be clear. That was a comment from a listener to the program. So you don't know who sent in that comment. And I don't even know who this person is. People are free to share their opinions and their questions. But Orlando, I would challenge you, because if you have ever listened to this program before, you would know that that's a ridiculous statement, in fact, that you've just made. Because I have always taken the position, this is where I stand, this is one of my core principles as a member of this community, as a Caymanian, that we need to learn to be more self-sufficient. You know, I grew up with an aunt who taught me how to be self-sufficient, taught me to go out there and try to make my own way in this world. And the singular thing that has enabled me to be able to do that is a good foundation in education. And I can go out there and hustle on my own. I have lots of skills and capabilities. And if I wanted to, I could work for other people as well. But I've been an entrepreneur now for over 20 years. And I love being an entrepreneur and being able to set my own goals and objectives. So I'm not sure who you're directing your comment to, because I can't personally take it on, because that can't be directed at me. Because like I said, if you ever listen to this program, you will know the countless conversations that I have personally had about being self-sufficient, setting yourself up for your retirement, making sure that you can handle your business. Not everybody necessarily has a supportive family, but if family is there, that is part and parcel of what you, especially if you have children, that is part and parcel of what you expect your children to do in your senior years, is to give back to you as a parent who has done right by them and who is, supportive of good parents. So I don't know what that means. The person made a comment, and I totally agree. And I've said it before. We do have a community that, we've become a little bit of on the socialist side, I suppose, where everybody wants to run to NAU. Everybody, wants government to do everything for them. And I don't think at all that is what government should do. Government, needs to foster an environment where we as Caymanians can go out there and make our own way. Right? I'm not into the begging mentality whatsoever. So, this person had a good point, and I'm all about that life. I'm all about if you can do it yourself. There are instances where for different reasons, people are not able to help themselves. That should not be the norm. That has to be the exception. And we have nonprofit organizations. We have other groups who are out there that they can pick up some of the slack and make those contributions. Big example, Meals on Wheels. They do a phenomenal job of helping to feed some of our seniors. Another great example is Mr. Amelia with her Caymankind Action Committee group that works primarily in Georgetown, giving seniors several days a week where they can get out of the house and they can have activities to play. You saw me there last week, hanging out with them and playing dominoes. They can play, a variety of different activities. And I have personally committed to them. I've said to Mr. Amelia that I will give them, I'll set funding aside from my very small budget to say every month I'm going to have some food catered or have Miss Stacy cook them some food, because she's a great cook, where we're going to provide them with some food for, one of their get-togethers. And that's how we can all make a difference and we can all contribute. It's not just about expecting government to do everything. That organization is in the process of trying to get a van together where they can help to transport seniors to their functions up and down. And if you want to contribute to these things, folks, you can be part of the solution in your community. It's not just about the elected officials doing everything or government doing everything. Government does have limited resources. And if you want government to have an unlimited budget, you have to know that's going to come out of your pocket. That's going to come out of my pocket. And that means that the cost of living is actually going to be increasing for all of us as well. So let's ensure, folks, that we see the bigger picture as well as the details. All right. So I got to run. I'm already late for my appointment. I'm going to give them a call now and give my apologies. But please have a good day. We'll be back tomorrow morning, of course, addressing all of these things. And, Chad, they were very specifically focused on healthcare today. They will be back onto the program. So this was just an introduction. Like I said, this was Emily's first time, but she will be back. So they've got all of the rest of this month. This is February, March, April. She will be back, and you can ask those specific questions of her. All right. So thank you, guys. Strong Will said, please don't stress Miss Stacy out now. Thank you guys so much for tuning into the program, and please have yourselves a wonderful Wednesday.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.